Bismillahirrahmanirrahim. My name is Dr. Amber Arshad, and today my topic of presentation is curriculum development under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be explaining a brief introduction to medical education. What is medical curriculum? Curriculum development according to the Kern cycle. What is Harden's integrated ladder of integrated course? Feedback and a few points regarding how it's important for the students. Curriculum development process in Pakistan, recent updates and MCQ session at the end. At the end of the presentation, the participants will be able to describe the basic steps in developing medical curriculum and its importance. So medical education. Medical education is also is a subject didactic academic field of educating medical doctors, and it works at three different levels: at entry level, at postgraduate level, and continuing medical education after that. And medical education applies theories of training, specifically in the context to this medical education. So what is a medical curriculum? A medical curriculum varies widely among medical schools and residency programs. And it is the main course that is taught to the medical students and is generally follow an evidence-based medical education approach. And the evidence-based approaches are published in medical journals. So starting from the learning, the main step for every student is to have a learning levels and to achieve the highest level of learning. And this was first presented by Miller's pyramid. And it's a way of ranking the clinical competence, both in educational setting and in the workplace. And Miller's idea strive to define education by its output and not by its inputs. This is the triangle that focuses on knowledge, skills, and attitudes. And it has levels, and starting from what is known and goes up to how it is done and how the tasks are performed. And the highest level of learning is the performance integrated to the practice, and competence is the essence of this Miller's pyramid. And the third tier of the pyramid represents the clinical skills competency, and the top of this pyramid is the clinical performance that is assessed by the direct observation in the real clinical settings. There is a complete medical education cycle that completes this whole process, starting from the teacher that controls the curriculum material, the teaching methods, the assessment methods, and also works in the clinical settings. Learners are responsible for what they are learning, and they are having learning either good or bad learning experiences. Development of knowledge, skills, and attitudes is the outcome, and best practices with patients, and this overall improves the patient's outcome. There are several key principles in order to achieve the goals of the goals of designing a good curriculum. For good curriculum design, the several principles are that it must be balanced, rigorous, coherent, and vertically integrated, meaning that meaning that the several subjects are interlinked, and they are vertically integrated and are giving the knowledge and are teaching integratedly, not on separate levels. Appropriate, focused, and relevant are other key principles. And there are several frameworks for achieving these curriculum principles shown in the previous slides. The two main frameworks are the PRISM framework and the SPICE model. And this PRISM model is for the clinical education that gives the product that is abbreviated as the PRISMs, that stands for product related, relevant, interprofessional, shorter, smarter, multi-sites, and symbiotic. Whereas the SPICE model is a model for integrated study that integrates the traditional curriculum of teacher-centered and goes up to the student-centered learning. Now for the curriculum development, we use the 6-step approach for the Kern cycles. That is a theoretical approach for curriculum development. And it is logical, systematic, dynamic, and interactive. The 6 steps of these Kern cycles of curriculum development are the starts with the problem identification with general need assessments. Then the need assessments for the targeted learners. Third step is setting the goals and objectives relevant to the curriculum development. Fourth step focuses on the educational strategies. Later, there is an implementation and evaluation and assessment at the end. And the small arrows in the circle shows the interlinking of all these steps. So these are the steps that are interlinked, and the criteria to develop a good curriculum, all these steps, all these criteria must be fulfilled. So first step is the problem identification general need assessment. It focuses that we should work smarter, not hard, smarter as well as hard, but more smarter than working harder. Time allocation is important. Clear definition they must be given related to who are the educators, the stakeholders, and the learners, and what are the potentials for the dissemination. So this problem identification is actually focuses on what is the healthcare problem and what are the current approaches for dealing this problem. Like it is the question, it focuses on the main issue, the main problem, and then what are the desired learning outcomes. So this builds a rationale for a curriculum and is grounded in patients and the societal needs, and it focuses on the goals and objectives and directs educational and evaluation strategy. So it is the base of the curriculum. And while going through this step, this problem identifications assess with whom does it affects, either the patients, providers, medical educators, society. How important is the problem, either quantitatively and qualitatively, and what does it affect, the clinical outcomes, the quality of life, and the quality of healthcare. So all these comes under the problem identification. The part B of this step is need assessment. Like learners learning environment is important. Who are the key stakeholders, and what are the institutional needs. This all comes under need assessment. So while going through it, we identify and critically analyze the healthcare needs or a problem, and analysis of the current approach is done according to the latest techniques, and identification of an ideal approach is done while doing a need assessment. What is targeted need assessment? This is a second step for the curriculum development. Targeted means that a specific population is targeted. For example, whenever we are developing a curriculum, we target a specific a population or a specific student class. Like we only want to develop a curriculum for the postgraduate students in a university. So this is targeted need assessment. Assess the environment, identify the needs and preferences of our targeted learners, build and engage and motivates the which engages and motivates the learners and increase their efficiencies. And this need assessments helps in targeted need assessments of a group of learners. What are their experiences, their expectations, their existing proficiencies, attitudes, and preferred learning styles. There are several methods for this type of assessment, like informal discussions, formal interviews, focus group discussions, via questionnaires, either by direct observations, test, or strategic planning sessions. Now, while moving on to the third is the goals and objectives which are set for developing a curriculum. So goals are broad and objectives are measurable, and the learning outcomes are the base for these goals and objectives. And it says this with the direct choice of curriculum content. What should be added, what should not be added in the curriculum. Helps identify effective learning methods, enable evaluation for learners and curriculums. And it also communicates a visions, like the broad general goals, the specific measurable objectives of the curriculum are clearly defined and set the content. So goal communicates the overall objective of the curriculum, and usually not measurable as written. General goals, like for example, in case of patient safety, the goal would be the residents will understand the importance of patient safety, reports on identifying potential system errors or challenges. Whereas the objectives is the reinforcement, refinement of the curriculum, and is through via direct education and evaluation methods. And there are 5 basic elements for these, for a setting an objective: who will do how much, and what and when. An example is that each resident will submit 5 patient safety reports via online database by the end of their inpatient family medicine rotation. So it's more specific, more refined, and and it's also there can be a time foundation So it's more specific than the goals. So there are objectives like the objectives focuses on the current capabilities of the learners and what you want to learn to achieve, like cognitive part, the affective part, the psychomotor process, and the process of patient and healthcare outcomes. Now, coming up to the fourth step is the educational strategies. It depends on the content, the method, the context, and the environment. The content and method that will most likely achieve the educational objectives. And for the adult learners, for setting an educational strategy, it's important to focus on experience, the pattern of learning, the need of immediacy, reduce and dialogue, and it also needs feedback. So different educational methods are reading, lectures, online resources, large or small group discussions, problem-based learning, and team-based learning. Also, there is peer teaching, reflections, role models, simulations, standardized patients, and role plays. These are all educational methods. Whenever we are implementing a curriculum, we need to follow this flow. Like first, we obtain the institutional support and secure the resources. Then we address the barriers and introduce the curriculum, and administer the curriculum. So while implementing this developed curriculum, we identify and obtain the resources and identify and obtain the support from the university, from the administrations, and from the other local organizations. Administrative methods to support and identify address the barriers. And then there is an introducing of the current curriculum pilot. And then there is the administering this curriculum, and laterly this curriculum is maintained. While coming to the evaluation and feedback, it focuses what did the learners learn? Did they enjoy the learning activity? Were the goals met? And what needs to change in the next cycle? This all comes under evaluation. So for an evaluation, there is a whole, and teachers also are effective in these meeting these learning outcomes. There is a whole teaching cycle that starts with the teaching or the learning activity. Later on, there is collection and assessment of evaluation data. And after that, there is reflection, analysis, and planning and preparations. And evaluation is important to identify areas where teaching can be improved, to inform all the allocation of the faculty resources, to provide feedback and encouragement for teachers, for students, to support applications for promotion by the teachers, and to facilitate development of the curriculum to meet society needs. So participation by teachers in evaluation via two can be by staff evaluation, self-evaluation, and peer evaluation. Self-evaluation is that academic staff increasingly evaluate their own practices. And self-evaluation is useful if the objective is to provide motivation to change behaviors. Whereas peer evaluation is direct observation of teachers by their peers and can provide an informed, valuable, and diagnostic evaluation. There is an Hardens integrated letter. Whenever we are developing a curriculum must be integrated. This is a new approach for an integrated curriculum, and there are tools for assessing, evaluating, and implementing these curriculums for the medical teachers. And one of them is the Hardens integrated letter. That is, creativity, adaptability, critical reasoning, and collaborations are the key features. And the method of learning accommodates a variety of learning styles, theories, multiple intelligences. This is the Hardens integrated ladder that suggests a sequential step for development of an integrated curriculum. And Hardens makes clear the progressive nature of the integration from one step to the next step. And this ladder helps to identify how integrated your product truly is and to the progress up to the ladder. So there are several levels going from the lowest level of integration to the highest level of integration. The first four steps are the steps on the ladder that emphasize on the subjects or the discipline to be taught. Moving up to the ladder, the following 6 steps emphasizes integration across several disciplines. And the final step, the student takes more responsibility for the integration and is given the tool to do so. So the highest level is the transdisciplinary level of this ladder. And lastly is the feedback, that learners who do not receive adequate timely and relevant feedback can rapidly become disheartened. So regular feedback is important for maintaining a learner's motivation by reinforcing good performance. And it also helps in reducing anxiety by encouraging him or her to understand and reflect constructively on the areas for improvement and growth. So there is a model, Nicole and McFarlane, Dick's 7 key principles for a good feedback. It focuses on, while going through this good feedback points, the first point helps clarify what good performance is. It explains it, facilitates the development of self-assessment that is in the form of reflection. Deliver high quality information to the students about their learning. Encourage teachers and peer dialogues. Encourage positive motivational beliefs and self-esteem. Provides opportunity to close the gap and provides information to teachers that can be used to help shape teaching. So there is a technique, a feedback sandwich technique that is mostly used in several institutions for giving a feedback. So this has several layers. The top layer, the top of the sandwich is the positive comment. The middle layer is the constructive criticism, that is a positive comment followed by a not focusing on the person's personal or the traits of the student, but they are generally a line or a type of a negative feedback and followed by a praise. So there is a constructive criticism or a negative feedback in the middle, and then it's later on followed by a positive comment that provides overall support. So there can be a constructive criticism or feedback or a destructive feedback. So a constructive feedback is an objective analysis of weakness and strengths of the students in terms encourage the writers to improve and move forward. And the destructive criticisms attacks the personally the student or a writer or a postgraduate or any student studying at any level of the at the institution. And these both are important, but what is it, what does the critic do, what does the writer get, and what should the writers do? These are all the steps for giving a feedback. There is another concept of scholarships of curriculum developments. So recently there is an approach to the higher education programming that integrates curriculum, and there is research integrations in the field of study. So there is a whole of the stages that starts with teaching. Then there is a scholarly teaching, that is the improvement of an individual's teaching by engaging with educational literature to design, apply and evaluate the teaching interventions, submitting his or her work to peer review, and then making use of the results. Going to the scholarships of teaching, that is the development of peer reviewed and publicly disseminated products which others can use to build up, and later on research, the original inquiry that leads to a new discoveries and increase and extends our understandings and knowledge. So scholarly activity opportunities are at local and regional levels, like national level, that MEDET portals. There are specialty sites, specialty meetings and journals, and there are several journals for these scholarly activities, like academic medicine, medical education journals, medical teaching, teaching and learning in medicines. There is a list of peer-reviewed medical education journals, but it's not limited to these 4 or 3 names. It's a huge field, and there are large number of papers that publish this evidence-based medical journals. So there can be, for example, MEDET portal at national level, Journal of Medical Education and Curriculum, Journal of Continuity. There are several like PubMed, Scopus, and various databases that provides many evidence-based medical, and that can be involved in this scholarly activities. Now coming to the briefly to the curriculum development process, Pakistan. First of all, whenever we are designing a course or curriculum at a university, the process starts with the concept stage. There are development of detailed proposal, the general information, the curriculum, the course evaluations. Then it is submission to the departmental board of studies. After approval from the board of studies, the matter is taken to university academic council for subsequent approvals. And final program accreditations is by the professional bodies, like for Medical Education Pakistan Medical and Dental Council was previous, but now it's Pakistan Medical Commission. There are the Pakistan Nursing Councils, Pakistan Engineering Council, regional accreditation and regulatory bodies, and Higher Education Commission, Pakistan. So the main accrediting bodies for medical education in universities is the PMC, the Pakistan Medical Commissions. For other universities, it's Higher Education Commission, and for the postgraduate trainees, residents, it's College of Physicians and Surgeons. So the takeaway message is that whenever we are following this whole procedure of Kern cycle and we are adapting this 6-step cycle, then it ensures that the problem is clearly identified. There is a lot of time for the adequate time for the development. It addresses the queries for the existing solutions. Objectives will drive the educational content and methods. All steps are interrelated, and continue to assess and refine your curriculum based on these 6 steps and consider dissemination of your efforts. Now, the recent updates. There was a recently published article of curriculum initiatives to enhance research skills acquisitions by medical students as scoping reviews. And in this review, it was discussed that educational activities that involves actively conducting research for the students or pre-registration medical degree programs with elective research most is effective and have positive findings, including research outputs, research self-efficacy, and career development. And uh, uh, at the same time, the cost, mentor availability, student motivation for doing research, and potential detrimental timeouts for clinical studies and quality of medical student publications needs to be considered. Second journal is the competence-based curriculum development for general practices, and it's for the its study was done in Germany, and it showed that improving postgraduate medical training is one of the important steps to attract more medical students in a general practice. A system of self-assessment for trainees was integrated in this curriculum via test version, and a peer-based methodology may support competence-based curriculum. Now there is an integrated medical curriculum design also in being run in a medical college in Pakistan, and this presentation by the authors help and promote critical discussion among scientific educators. Medical education and examination departments have played a vital role in organizations of the annual academic map, synchronization of curriculums. Therefore, the well-organized modular curriculum proved helpful with minimizing workload, anxiety, and stress of the examinations on the students. Now it's time for the MCQs. A teacher in a XYZ institute wants to arrange a lecture for undergraduate medical students focusing current knowledge regarding improving in the clinical outcomes and quality of life of patients. This type of teaching comes under which heading? Problem identification, need assessment, evaluation, feedback. The answer to this is clearly defined that whenever we are focusing the knowledge regarding the clinical outcomes, quality of life, we are focusing on the problem identification. So the first step of the Kern cycle, this is the problem identification. A is the answer. A researcher wants to identify the gaps causing differences in counseling skills among the residents of various universities. He finds that the residents from University X are less skilled in counseling compared to the residents from University Y. Via which of the techniques? Evaluation, targeted need assessment, problem identification, implementation.
B.
Yes, the answer is B, since we are targeting a specific student population. So the answer would be B. When developing or revising a curriculum, the physical education staff must consider its value orientation towards the existing curriculum and the proposed changes. This process focuses on all of the following major components, except which of the following? Either the community that has established the university, the experience of the teaching staff, the students of whom the curriculum is being designed, and the subject matter to be learned.
C.
Students are an important part for designing and revising a curriculum. So a community that has established the university is the option. In developing learning outcomes-based curriculum, the formulation of objectives in behavioral terms poses a challenge for which of the learning types below? Learning of facts and informations, learning of concepts and principles, learning of application and use, learning of critical and creative thinking. In behavioral terms, the answer would be D, learning of the critical and creative thinking. In an institute XYZ, the teaching faculty of a department wants to start a new program for which they want to develop a curriculum, following the standard 6-step approach. Which of the following will be the third step in developing a curriculum? In this case, problem identification, evaluation, setting goals and objectives, need-based assessment.
C.
Yes, setting goals and objectives would be the third part, that is the that focuses on setting goals and objectives. The sorry. A major skill, knowledge, attitude, and ability to perform a task efficiently and effectively is known as learning objectives, competency, assessment strategy, and assessment criterion.
Competency.
Yes, answer is already highlighted. Sorry for that. Competency is the answer. In an institute XYZ, the teacher notices one of the students' activities and observes that he does not seem as motivated on the projects before. He says, "You were always proactive in the projects you take on, but I have noticed that you have taken more of the backseat in the last few projects." This is an example of negative feedback, destructive feedback, constructive feedback, or neutral feedback.
Destructive feedback.
Destructive feedback is not an option because this feedback starts with a positive comment, and then there is a comment followed by a positive comment, that is that it has noticed that she has taken the backseat in the last few projects. So this is the example of the constructive feedback. A teacher XYZ wants to give feedback according to the feedback sandwich methods, who are presenting at the annual research conference being held in an institute. Which of the following comprises the second layer of the sandwich below? First, telling the team members the content was in depth and it had great examples. Letting the team members know the slides needed some improvement to be more personal and engaging. Overall, the team members did a wonderful job in explaining the core subject in the audience and giving no in-depth comments due to the time constraints. It's according to the sandwich methods who are presenting.
B.
Yes, the answer would be B, because the second layer of the sandwich methods might involve a negative comment. In an institute XYZ, the students were taught research methodology only in community medicine class, but never in other subjects. Teacher wants to develop and design a curriculum that connects different areas of study by cutting across subject matter lines and emphasizing unifying concepts. This is an example of which type of curriculum? Integrated, focused, null, hidden.
Integrated.
Yes, it's an example of integrated curriculum. In an institute XYZ, the principal wants the teachers to take some time off and reflect upon and describes their teaching and learning goals, challenges and accomplishment. This can be achieved by a self-assessment, summative, student assessment, formal assessment.
Summative.
No, it's for the teachers, so it would be the self-assessment. Summative assessment is for a course at the end of the course whenever it's completed. This is the key. References are the textbooks, and the figures are taken from the textbooks ABC of Learning and Teaching in Medicines, and later on the references. And thank you.